I am happy always to have my next guest join. It's Dr. Ngozi Ezike. She began serving as president and CEO of Sinai, Chicago, which is the largest private safety net health system in the state of Illinois. She went there in June of 2022. You will recall that Dr. Ezike is the immediate past director of the Illinois Department of Public Health, where she valiantly navigated the state through the COVID-19 pandemic as she gave us the real information about what was going on in English and then turned and showed off her Spanish in doing it as well. But glad to have her join us this morning to talk about some of the other things that are going on in the area of medicine, particularly as it relates to cancer. Dr. Ezike, good morning and welcome back to WVON. How are you today?
I'm great. Good morning. So glad to be with you this morning.
It's always good to have you. And every time I see you and talk to you, it's like, Dr. Ezike, you never come on my show. And then you always tell me that, actually, I do. So I don't know why you don't say that. So always good to have you. Talk to us about what's happening over at Sinai. You've been over there now for a few years. How's it going?
Yeah, the struggle is real. We are doing God's work. We're taking care of everybody. We're not focused on, what kind of insurance you have or don't have. We just want to help you have life and have life more abundantly. But the reality of it is that we have this tiered system of, healthcare and healthcare payments based on, who you are and what you have. And so the communities that we are so honored to serve are a largely Medicaid population, and that reimbursement does not cover the cost of care. So we struggle on a regular basis to make ends meet, do more with less, wear multiple hats, be everything. So it's an ongoing struggle. We continue to count on our partners, in government to help us, in the philanthropy world, and we're looking for corporate support. We're always looking for people who believe that healthcare is a right for all to join us in this amazing work to take care of some of the most underserved communities in the city of Chicago. At the end of the day, a healthy Chicago depends on every community being healthy. That helps promote a healthy workforce, a productive city. And so I think our communities are so important, and looking for partners who believe in that and want to help elevate the health of all of Chicago.
Dr. Ezike, help us understand. You are a safety net system, and as you describe the work and the people that you care for and how that happens, separate from us what you do there at Sinai and what happens at a place like Cook County.
That's a great question. It's actually the same work, right? We're taking care of the same population. We're providing a lot of those critical services. I think we probably delivered twice as many babies as county. We are also this level 1 trauma center. We have the highest level of the intensive care unit for those tiny babies. The difference is that we don't have the base of a county government, to have access to county tax dollars to support our work. And so we are dependent on the insurance reimbursement, which, again, I've said is very low when you're predominantly Medicaid. And we have a large number of completely uninsured people who are, fall under the charity care or self-pay, and that means we don't really get any money at all. So same work, just less support for the work that we're doing compared to a government, public entity.
Yeah, always a difference in how the money comes in, because that's going to be important no matter what you're doing as you work to try to service these people. Let's talk about what's happening in the space of cancer. The American Cancer Society recently came out with their annual report about cancer mortality and where we stand and what the trends are. Tell us about what the report tells us.
Yeah, there's a lot of important information. We always have to keep an eye, on what's going on with cancer and cancer facts. I always like to start with the good thing, and the truth is that we have gotten better and better at treating many kinds of cancers. But even with that, there will be 2 million people that will be diagnosed with cancer in the United States this year, over 2 million people. And everybody's not going to die. Cancer does not mean death, but there will be over 600,000 deaths. And that's significant. We know that overall, cancer death rate is declining. And, you can attribute that to, reductions in smoking. We hope that that doesn't get reversed with some of the new practices with vaping. We know that there are lots of improved treatments. As you increase access to care, again, this is why, safety nets are so important, because they're increasing access to care for communities that traditionally have not had the access. That allows for early detection. And so hopefully you can identify something quickly and avoid the death, avoid the mortality. What we are seeing, and I'm sure this is no surprise to you, we're still seeing those disparities in terms of who dies and who survives from cancer. And so we are seeing our minority populations, Black people are twice as likely to die of, maybe prostate cancer, uterine cancer. There are cancers that Black people are more likely to die from. And so those are really glaring warning signals to tell us that there's more work to be done. We've also seen this interesting shift. It used to be that men got cancer at a higher rate than women. That's almost equaling out, where it's, about the same rates in men and women. So that's a shift. We're also seeing that there are some cancers that are happening more in younger people. That's obviously of concern. And so, again, you've got to take in all of this information so that you can figure out, what are the next steps. The next steps involve figuring out why some of these things are happening, and then, collaborating with, healthcare providers, researchers, maybe even policymakers and community to figure out what are the adjustments, what are the pivots we need to make, because we want everybody to have life and life more abundantly. So we want to be able to not just treat cancer effectively, but prevent it in the first place.
So important what you began with, Dr. Ezike, because you talk about the mortality rate is dropping because of drops in smoking, and in some cases it's better treatment and earlier detection. But as we began talking about what you do there at Sinai and what happens at other safety net places, are we finding that are Black folks are we still subject to not going to the doctor? Are we still not getting early detection, and are we still not getting the best level of treatment as others are?
Yeah, no, in the African American community, there are a myriad of causes for why we are seeing, these inequalities. Part of it will be access. If you look just at the city of Chicago, when you look at, some of the hospitals that may have closed, actually, if you look nationally, a lot of the hospitals that have closed, in the last 10 years have been safety net hospitals, and those are institutions that primarily serve, minority communities. We also know that, we need to continue education and make sure that people understand the importance of those, visits, even when you're not feeling bad. A lot of people say, why would I go to the doctor? I feel great. But, not understanding the importance of screening and regular checkups so that you detect things early. We know that in the African American community, we have a much higher rate of chronic diseases. And those chronic diseases often can lend to some of these cancers. So being able to keep ourselves at a lower appropriate weight, that's really important. Staying physically active, having access to healthy food, so having grocery stores in the community where you are able to get fresh produce. All of these things play into some of the reasons why we see these disparities.
Thank you for that. There's so much more in this report that I want to get into a little bit more, particularly as it relates to things like pancreatic cancer and where we are with that. And some of the incidence rates are continuing to climb, although the mortality rate is declining. So much more to talk about in the information that's been released by the American Cancer Society. Happy to be able to talk with Dr. Ezike about it. Welcome back. We're talking with Dr. Ngozi Ezike of Sinai about the American Cancer Society and their report for 2025 on trends and such. Dr. Ezike, the report talks about the overall declines in cancer mortality, but it says death rates are increasing for cancers of the oral cavity, pancreas, uterine corpus, and liver in females. This thing about pancreatic cancer continues to be an issue that thwarts us. Are you aware of, has any progress been made on trying to determine that earlier than we currently know?
Of course, there's ongoing, research, trying to understand that this specific cancer, I know pancreatic cancer this has directly affected my family. It is one of the cancers that has, one of the lowest survival rates. And so understanding that still is something that needs ongoing research. Our partners at the American Cancer Society and so many different organizations are still working on, better treatment, how to detect it earlier. And then ultimately what you always want in any cancer is how do we prevent it? What is the cause? And so still a lot of work to be done, but it definitely is a significant cancer with a very high mortality rate, which means that there's a lot more work to be done.
You mentioned earlier about not smoking, about maintaining one's weight and exercise as being ways certainly that we can help to control what some of these cancers are. I know some things are hereditary, so those are a little bit more challenging. But when we start to think about prostate, when we start to think about stomach, when we start to think about uterine corpus cancers, what is it that people can do at all that helps to control some of that?
No, the things you mentioned are really the key. As much, I don't know if I can say healthy living as possible, not smoking, not drinking. I think things that we forget about that are very critical are getting adequate sleep. Your body restores and rejuvenates itself during the sleep time. So getting quality sleep and enough hours of that's critical. You mentioned being physically active, eating lots of fruits and vegetables, getting screenings, getting those medical checkups, trying to avoid having, diabetes and heart disease, obesity, and getting those regular checkups to be able to identify anything earlier. All of those are really important, for women, and thinking about cervical cancer. That's something that wasn't available 50 years ago, is there being a vaccine to help prevent cervical cancer. So getting that vaccine is obviously part of helping prevent cancer as well.
Oh, the vaccine, and now RFK is coming into office. Tell us, what are your thoughts, Dr.
You are not going to you are too much trouble. Let's wait and see, right? Let's wait and see.
All right, we'll pick that one up next time. Let's go back, though, because you did mention earlier about lung cancer. Lung cancer incidence in women has surpassed that in men. Why would that be?
Once you get these stats, that's just the first part. Then you have to do more research to kind of figure out what's behind that. What's going on? Because that's how you get to figure out, are there new practices that women are engaged in that are increasing that incidence? And so it's also a very important warning sign and a kind of a bell for us to ring that when we are looking to figure out why these trends are differing from what they were even just a few decades ago, we need to be studying all people. And so research trials and research studies have to include all populations. And that's where, African Americans, people of color, minority populations are often not included in these research studies. And so you're not getting the full breadth of what's happening to people across all spectrums. Sometimes it's the exact same causes in all groups. Sometimes it's not. But without studying, a representative sample that includes everyone, you can't know for sure. And so we have to be ready as a people to be engaged in that. And we need our researchers to understand the importance and be reaching out to all communities to be included as we try to answer these questions that are dogging us and that need answers.
Dr. Ezike, you are, given the work that you've been doing throughout, and certainly the work with Black folks, we tend to be subject to a lot of environmental issues that will create cancers. And it may be because of where the housing is, near plants, near water, near places that people just, where the air blows in a bad way because of how the factories are there. What is it that we can do for that? Is the answer there looking at more legislative responses to try and deal with that?
No, I mean, the environment that we inhabit definitely plays a role. And we do know that communities of color, their air, the air quality is lower, higher rates of, smog, higher rates of pollution, higher rates of other kinds of, pollutants in the air. We know that just the way that some of our cities were set up where, the highways were going, through our communities, which lends itself to the additional pollution and the emissions from the cars, where factories were built, like you mentioned. You've seen some of those headlines about how our water has been treated. There's incidents of, lead paint in the homes in our communities, which has led to, lead poisoning, which affects kids and going on. So there are a lot of environmental issues. And so that is another, route that we have to pay attention to, that our legislators and community leaders have to be, pushing for things that will be monitoring this so that we can adjust and fix those areas that are directly affecting our health, that are outside of, healthy eating and outside of having access to a mammogram or a colonoscopy.
Dr. Ngozi Ezike, thank you so much. Always information, and we certainly always appreciate, the work that you're doing at Sinai and you coming on to share with us. We appreciate you.
What an honor to be with you. Thank you for this time.
Be well. You are such a